Welcome back to another episode of Shift Happens. Why Moms Are Dying, a crisis we can't ignore. Welcome to Shift Happens, where we serve up real talk, slice by slice, no fluff, just the meat of the matter. I am your host, Corrina Jackson, your bougie, confident boss lady, your morning snack, your noonday nibble, and your evening unwind. Walking in the purpose and shifting the atmosphere one day at a time. Now, today we're going to be diving into a silent crisis that deserves everybody's attention. Maternal mortality. Why are women still dying during pregnancy and childbirth in 2025, especially in a country with all of this access and all of this technology, all this potential? Let's get into it. The tragic truth by the numbers. Here's the hard truth, guys. The United States has one of the highest maternal mortality rates among developed nations. In Tulsa, yes, right here in our own backyard, we're not exempt. Not at all. According to the CDC, about 1,200 women die in the U.S. from maternal mortality causes in 2023. That's over 3 deaths per day. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women, regardless of income or education. And get this, most of these deaths are preventable. Yes, preventable. They aren't just stats, guys. These are mothers, sisters, daughters, best friends, lives lost that could be saved with better care, better systems, better support. It's not just about access, it's about action. Now, let me make it plain. Access to care is part of the problem, but it's not the whole story. Too many moms are dying because of this. They aren't heard when they say something wrong. The symptoms are dismissed or downplayed. They don't have someone to advocate for them in the delivery room or in the doctor's office, or they simply don't have prenatal care at all because there's no provider near them or insurance to cover the visit. And Oklahoma has a lot of maternal deserts, meaning that we don't have the actual facilities in place for an individual that's pregnant to actually access prenatal care. There's actually, I would say, midwives maybe, or nurse practitioners is the word that I'm looking for in those areas, but not someone that actually deal with prenatal care. They may be a doctor in those areas, but like I said, someone, you know, they don't have access to someone who actually does prenatal care, like a OBGYN would be the ideal person or individual that they would be looking for if they were pregnant. And we don't have those in some of the areas, so they're called maternal deserts. Now, let me just go on to say that here in South Tulsa, Shift Healthy Start, which is supporting healthy initiatives for Tulsa Healthy Start, well, we're kind of like boots on the ground. We walk with moms through every step, whether it's their prenatal appointments, their education, transportation, postpartum checkups, and emotional support. Because sometimes saving a life looks like a ride to the doctor. It may be somebody or someone listening to her when she says that she don't feel good or don't feel right. Sometimes it might be just making one phone call that changes everything. Postpartum danger is real, y'all. When we often think of maternal health, it ends when the baby is born. No, it doesn't. It doesn't end when the baby is born. That's wrong. Many maternal deaths happen after delivery, in that 4th trimester, if you will. Moms and mamas are going home with C-sections, high blood pressure, mental health crisis, and nobody to check on them until the 6 weeks later, if at all. That's unacceptable. That's kind of what I'm calling the fourth trimester, if you will, because we know that there's 3 trimesters. But I always say that fourth trimester is after the baby is born, after the baby delivers, after the mom has gone home, and that 6 week window comes into play. That's kind of what I'm referring to when I say the fourth trimester. So, that's why we teach women at Shift Healthy Store to know the signs. I mean, we really have extraordinary case management. We call them the care coordinators and our navigators. They really are someone that you can lean on and talk to about your pregnancy, but they're also someone that you can lean on and talk to after the baby is born. That's the impact that they make on the moms. They build bonds with the mothers. And throughout that, they learn different signs that the mother may be experiencing, or the mom might identify signs that they don't feel right, that they can share with their care coordinator or their navigator, such as shortnesses of breath or headaches that don't and won't go away, heavy bleeding, chest pains, and to speak up and to speak out. That's so important. I mean, so many times I hear stories of moms that are scared to even mention something to their doctor or their nurse because they feel like, they feel stupid in saying something, or that the doctor or the nurse is too in a hurry to pay attention to what they're saying, or they simply just are not listening or won't listen. I hear too many stories about that. And so we're constantly pushing and educating moms to speak up, but then we need the provider to give them that time and that space to do so and to really listen to what the client is saying or what they're experiencing. So that's why I said it's so important to speak up and to speak out. And if someone is not listening, demand that they listen, because it's your body. And we don't want somebody to go home and experience a trauma that, they never get over. And that's why we advocate for home visits and community doulas. We advocate for nurses and navigators who can catch the warning signs before they turn deadly. And that's that trauma that I was talking about, going home. And it's nothing more sickening than to hear about a baby's death that could be prevented. And it could be prevented by listening to what the mom is going through when she's going through something. It's already hard enough for the mom to even talk about it, but it's even harder when the provider dismisses it. And so at Shift Healthy Store, like I said, we advocate for our moms. We advocate for our fathers too, don't get me wrong. But we advocate for the mom because the mom is actually carrying that live human being in her body. And so after she delivers it, like I said, if you're a first time mom, you don't come with those instructions on actually how to care for a baby. So it's important. Some moms that I know, they even write down signs so that when they go back to the doctor, they can discuss those signs with the doctor. Those are the kind of things that we talk about doing at Shift Healthy Start, identifying those signs, writing them down. And if it's something that, can't wait till you go to the doctor, then pick up the phone and call your provider and say, this is what I'm noticing with my baby. But not just with the baby, but with your body as well. It's so important that you notice, like I said, those signs, those headaches that won't go away, or if you're hemorrhaging or bleeding or whatever, you need to be able to identify what is going on. And if you can't identify it, it takes two heads sometimes to come up with what is going on with my body. Faith, legacy, and what we can do. This is bigger than any one program. Mighty Shifters. This is a legacy. It's about making sure our babies grow up with their mothers. It's about making sure Gigis like me, because that's what my grandbabies call me, don't have to raise grandbabies because their mamas didn't make it. We want those moms to live. We need to normalize asking for help, checking in on postpartum moms, and demanding better policies. Now, here's what you can do. You can volunteer with local programs like Shift. You can educate yourself and your family about maternal warning signs. And Shift Healthy Start has an educational program for groups who don't have to be managed clients within our program. You can actually be someone who knows someone is pregnant or just kind of want to learn those signs. We have education programs for that. That's something that our funding source makes sure of. We educate our communities, and that's so important for us now. And we've been striving and pushing hard to do that. So, if you can help us provide that type of care by educating yourself, we welcome you to join those groups. You can call our agency. You can go on to our website and locate our phone number under shift-tulsa.org. So I'm going to say it again, shift-tulsa.org, and drop us whatever questions you may want us to answer, because we pay attention to that as well. Donate to grassroots organizations saving lives right now. Right now, on our shift-tulsa.org, you can find how you can even donate to our program. We can't do this by ourselves. It takes many efforts. It takes a lot of money. It takes community efforts. It takes people like you giving a care. I was going to say another word, but I didn't say it. But giving care to these type of programs. Even though we're federally funded, we also take donations from community, churches, whatever, to help us push our effort. We're open to that. This is not just a medical issue. It's a community issue. It's a human issue, if you will. It's a moral issue. So remember, shift happens when we face the hard truth. And remember, this podcast is about facing the hard truth. It's about talking about the hard truth. Shift happens when we put our money, our voices, and our hearts where the need is. Shift happens when we say enough is enough. So, to every mama listening, we see you, we love you, and we're fighting for you. And to every listener, now that you know the truth, what will you do with it? This has been another episode of Shift Happens with Corrina Jackson. Real talk, real impact. And mighty shifters, take care of yourself. Mamas who's just had babies, take care of yourself. And if you really, really want to make the most of it, take care of each other. Now, until next time, mighty shifters, I love you. And please continue to like, subscribe, and share these podcast episodes. And if you got something out of it, somebody else will too. Share these podcast episodes with someone else. I thank you again for listening. Supporting healthy initiatives for Tulsa, thanks you again for listening. And of course, Shift Healthy Start, thanks you for listening. Until next time, bye for now.